you can see there was a reconstruction of UCL because of an old Stener-Lesion, and the patient sustained a new injury 1 week ago. I mean, the first thing we can see is that the graft here is still intact. There's some scarring happening along the graft, but there's no edema indicating that we have actually like a re-tear of the UCL reconstruction. So I think that's fine. What we can see though is there's some bone marrow edema on the dorsal aspect of the head, and we can also see this here, dorsal head here, bone bruising here, so suggesting some form of hyperextension injury. This is the artifact from the screw. I'm not sure if there's some underlying bone bruising here, but I don't think that's necessarily the case. The dorsal plate here shows a little bit of degeneration, fraying. The recess here is normal, so this is how the dorsal plate looks like. Maybe there was a little bit of a contusion or something like that, but not torn. The tendon, the flexor tendon here is okay, but what we can actually see is a tear of the volar plate. First of all, a little bone bruise in the ulnar sesamoid, and then the radial sesamoid here is fine. So let's start on the radial side. Radial collateral ligament, first thing we want to look at, is intact. So we can see this is the proper radial collateral ligament from bone to bone. When we go more volarly, now we start to see there's a gap here. The sesamoid is actually this one here, but there is nevertheless a gap. So let's have a look at the normal anatomy. I typically use this figure when I'm thinking about injuries of the MCP joint of the thumb. So we can see the proper ulnar collateral ligament, and this is the same on the radial side, right? So assume this is the radial collateral ligament. Now the accessory radial collateral ligament would be going into the volar plate or the sesamoids if we have any. So what happens here in this case is we can see, while the proper radial collateral ligament is intact, we can see a tear, or at least a high-grade partial tear of the accessory radial collateral ligament. Sesamoid insertion is okay, but the insertion into the volar plate is torn. So here we can see this is now the head. This is the origin of the radial collateral ligament proper. If you follow it, we can see it's inserting nicely. But here this part is torn. This is the accessory collateral ligament component. And on this sagittal, I want to show it also here. So this would be the proper radial collateral ligament, and then we have this fan-like appearance of the accessory collateral ligament, while the insertion here into the sesamoid location, this one is intact. The more proximal one here is partially torn. And the tear then propagates from this accessory radial collateral ligament here, this is the tear, all the way into the volar plate. You can see joint recess here, torn gap, torn fluid going down outside of the joint. This is the sesamoid. There's a tear. This should be attaching nicely here. Going back, this is the tear gap, tear, going more medially. Even here, fluid transecting down. This is the recoiled volar recess here, and even here, tear, and this is now the ulnar sesamoid. Even here, you can see this should be the insertion. This should be nicely attached to the sesamoid, but it's not. So tear, and then here, maybe we don't really see much here anymore, but tear here, tear here, tear here. So the whole volar plate is torn.